Yeah,
Right
no,
there.
and it can. It can, if it get pierced posteriorly, certainly breaking your ribs can. So yeah. And that's about an inch to an inch and a half above the collarbone that that area would reach. This is known as the base. And then we also have surfaces, and so our terms for the surfaces sometimes overlap. The base surface is also known as the diaphragmatic surface, because it's resting, well, not resting, but it can extend to the diaphragm on a deep breath. The anterior, lateral, and posterior surfaces are known as the costal surfaces, because they're going to be related to the lungs, to the ribs. So I'll show it to you on the model in just a second. All right, so all of this, you can even see the indentations where the ribs were. So, and this anterior, lateral, and posterior surfaces are the costal surfaces, whereas this area here is the diaphragmatic surface. Okay, as a structure is the base, and this is the apex. Then we have the medial surfaces. Remember what we call this space where the heart is found? The middle mediastinum. So these surfaces are the mediastinal surfaces, where we have the airways and blood vessels moving into and out of the lungs.
So the whole exterior is the costal surface?
Anterior, lateral, yeah, so the front, back, and side. The medial is the mediastinum. Now both lungs on their medial borders have an indentation. It's much more, I need to move this a little bit farther down. It's much more extensive on the left lung and is known as the cardiac notch because the heart is more on the left side. So there's not much of a cardiac notch visible on the right lung. And then this tail end of the left lung, I had to move my fissure down a little bit because I had it too high up. Looks to somebody like a tongue, and so is known as the lingula. And that would be this portion right here. We only see it on the left lung, which is absent. Good thing it's front half there. I'll come back to that other picture in just a moment. So these are the structures. Here's the pulmonary trunk and the pulmonary veins. Remember, artery blood is deoxygenated and venous blood is oxygenated, along with the trachea and the bronchial arteries, which aren't shown. And these are passing into and out of that mediastinal surface to an area known as the hilum or hilum, the same term we had for the lymph node, where we had efferent lymphatics and blood vessels. Look at the relationship of these three structures. On the right side, the bronchus is posterior to the pulmonary artery, and the pulmonary artery is, the veins are anterior and inferior to the pulmonary arteries. Right? On the left side, the pulmonary artery is superior to this bronchus as it's passing into the lungs, and our veins are still inferior. So from that sequence, here in a, do I have a larger one? Here on the lung, would this be a right lung or a left lung?
Left.
Right. It looks like there's three. Right. It looks like
Oh,
there's
there's
three.
three, so it'd be right.
This is always confusing to students who see it and think it is the aortic arch. What is it? This is the right lung. What structure do we have?
Superior vena cava?
Well, superior vena cava is going to be right here. What drains into the superior vena cava? I heard it. The azygos. So this is actually the azygos indentation here, along with the esophagus. That makes it look like the arch of the aorta. So yes, it is three lobes, so it is the right lung. Would you be able to tell if all I showed you was this, however?
Yes. I'm guessing.
Bronchus is posterior to pulmonary trunk or pulmonary artery by this point. Remember that previous picture that I just showed you? Here's the pulmonary artery, the right pulmonary artery passing anterior to the right bronchus. Okay, so that's the pattern that you see in this right mediastinum. Bronchus is posterior to the pulmonary artery. Now look at the relationship on the left lung. Pulmonary artery, bronchus is inferior because that pulmonary artery takes a loop over the left bronchus. So very small. There's the zygus going posterior, right? And then the pulmonary artery going superior on the left side. Finally, let's finish up by looking at the, here I've got these side by side so you can tell the difference. Let's come back to this image here and look at the pleura. Most of you are familiar with the term pleura. So I'll use the, and we'll identify the fissures as well. Let's do that first. Let's do the fissures first before we do the pleura. You'll be able to see these fissures also on the sheet plus on Tuesday. So on the right side only, we have a horizontal fissure. You see right here. The horizontal fissure is going to separate the superior lobe from the middle lobe. And obviously only on the right side. We don't have a middle lobe on the left side. Okay, this fissure is the oblique fissure. And it is present in both right and left lungs. And so the oblique fissure is going to separate the middle lobe from the inferior lobe on the right side, and the superior lobe from the inferior lobe on both right and left. Now, how does it do it on the right side? So here obviously is superior lobe and inferior lobe. Here's middle and inferior, so that makes sense. But how on the right side does it separate superior from an inferior? Look at this model. So here is the anterior part of the lung. We swing it around. Notice the oblique fissure right here and right here. So this is the superior lobe. Notice how high posteriorly the inferior lobe comes. So it's on the posterior aspect on the right side that the oblique fissure separates superior lobe from inferior lobe. Okay. I'm going to use you since you're sitting right here. Do you mind standing up? So if you're listening to lung sounds, actually turn around. If you're listening to lung sounds, the location of that oblique fissure is just here at the scapula. So if you're listening with your stethoscope for lung sounds, up here you're listening to superior lobe. Anything at the scapula or below is going to be, at least in the lower part of the scapula even, is going to be inferior lobe. Thank you. All right, so you put your hand on like that, so where you put your hand and you rest your fingers on the shoulder, you're on superior lobe. Anything inferior to that is inferior lobe. So my pneumonia was actually in the superior lobe on my right side. So when she had her stethoscope there on my shoulder, she could hear the rails or the wet sounds that air makes. It's kind of like if you take your hair and rub it against another hair, that's what it sounds like. You have fluid in the lungs. And so that's because that portion of the superior lobe, extending the inferior lobe, extends up quite high. There's a smaller portion on the posterior aspect. Okay, we'll stop there. We'll do pleural when we look at pressures on the lungs. So I'm going to give you back your lecture exam. You have about 20 minutes, 25 minutes to look at those.
We're awesome. That was hilarious. I don't know why it was so funny. It was funnier than I thought it was going to be.